Hi, my name is Key Austin White, and I am the planner for the Bureau of Health Equity. Throughout February for Black History Month, we will highlight some of our community partners, state employees, and community members to talk about Black History Month, what it means to them, and the work they are doing in the community. Today, I have the privilege to be interviewing Dr. Cuffee, Assistant Professor at Epidemiology for the University of Delaware. So, Dr. Cuffee, tell us a little bit about yourself. Where are you from? What do you do?
Great question. Yes. So I am actually originally from Alexandria, Virginia. I grew up in the Washington, D.C. area, but I've lived up and down the East Coast from D.C., Virginia being the most southern part to going to school in Massachusetts being the most northern part. Currently, I'm an assistant professor of epidemiology at the University of Delaware. I've been there for 2 years now, and I'm also the associate director for the Partnership for Healthy Communities at the University of Delaware. And I'm a researcher and also a teacher of social epidemiology.
How did you get into this profession? What inspired you to get into this profession?
So I started out my career working in clinical research, like doing clinical research management. And one of the things that I noticed early on is that we were seeing a lot of differences in the outcomes, particularly infections and things like that, that were different for our Black and Brown patients. And so one of the things I was really interested in doing is trying to understand why are we seeing these differences. And at the time that I was working, it wasn't something that we were exploring, and health disparities and health equity were really things that were just kind of coming to the forefront at that time. But I felt that it was important for me to understand the unique experiences of Black and Brown people that inspired me to go to graduate school. And when I ended up going to graduate school and having the experience of hopefully working in orthopedics, but I ended up working in hypertension instead. That's where I was really able to expand and start to explore how hypertension uniquely is affected in African Americans and in general people of color experience hypertension, high cholesterol, and other cardiovascular diseases. And that has always been the driving force. So
Did your cultural background impact your entry into the profession?
absolutely. So one of the factors that I was really interested in was looking at prostate cancer, and I knew that it was something that was really a burden among Black men, and it affected my family in particular. My father and my grandfather both had prostate cancer, and so for me, I wanted to understand why this was happening, and I really wanted to figure out what we could do. So one of the things that drives me is developing interventions, programs, and studies where we can actually figure out not just these race-based differences, but looking at the social factors that are really some of the drivers we see in these differences. So differential access, differences in insurance, differences in where an individual receives healthcare, and how those factors are really contributing to a lot of the disparities that we see. I was definitely passionate about promoting and advancing health in the Black community.
Thank you. Why do you think the history of Black people in America is important?
Black people in the United States, we have a great history, a great background. We have contributed to this country in so many ways that in the past weren't recognized, but now are really becoming more recognized in our country. And I think that that's something that we need to acknowledge and celebrate and understand, and so that our children are actually able to see these wonderful examples of what Black people in this country have been able to accomplish and what we're going to continue to accomplish in this country and beyond.